Begin by introducing the second trimester, which spans from weeks 13 to 26 of pregnancy. This period is often called the golden trimester because many early symptoms, such as nausea and fatigue, tend to ease, allowing mothers to feel more comfortable and energetic. Mention that, for many women, this trimester is the most enjoyable, as the baby starts to grow rapidly, and some exciting milestones are reached. Physical changes in the mother. 4 minutes. Dive into the physical changes that mothers can expect during these weeks. The belly will start to show as the uterus expands, and some women may notice back pain or minor discomfort as the body adjusts. Highlight other common changes, like the appearance of a dark line on the belly, linea nigra, and the famous pregnancy glow that some mothers experience. Symptoms such as heartburn, leg cramps, and an increased appetite may also arise. Reassure viewers that these are all normal parts of the second trimester and share tips for managing any discomfort. Baby's development. 4 minutes. This is a critical time for the baby's growth, so emphasize major developmental milestones. Explain how the baby's organs continue to mature, and senses like hearing and touch begin to develop. Around weeks 18 to 20, the baby can start responding to sounds, a detail that many parents find exciting. Including visuals, like images or animations showing the baby's development, can make this segment more engaging. This is also the time when the baby's movements may become noticeable, creating a strong bonding experience for the mother. Prenatal appointments and tests. 3 minutes. Prenatal care is essential during this period, so explain what mothers can expect at their appointments. Typically, these visits will include checking blood pressure, monitoring weight, and listening to the baby's heartbeat. Mention the anatomy scan, usually performed around week 20, which allows healthcare providers to check the baby's growth and development in detail. You could also touch on other common tests or screenings that might be recommended based on individual circumstances, giving mothers a sense of what to expect. Nutrition and self-care tips. 3 minutes. Good nutrition and self-care are especially important in this trimester, so dedicate a section to this topic. Encourage a balanced diet that includes key nutrients such as iron, calcium, and protein, which support both the mother and baby's health. Suggest gentle exercises like walking or prenatal yoga to help with energy levels and prepare the body for childbirth. Additionally, address the emotional side, mentioning ways to reduce stress and connect with the baby, such as reading, talking, or playing soothing music. Warning signs and when to contact a doctor. 2 minutes. It's crucial to educate mothers on potential warning signs that might require immediate medical attention. Symptoms such as severe abdominal pain, heavy bleeding, or persistent headaches should not be ignored. Emphasize the importance of listening to their body and reaching out to a healthcare provider if something feels off. This section reassures viewers that seeking help is a proactive step in ensuring both the mother and baby's well-being. Preparing for the third trimester. 2 minutes. As the second trimester comes to an end, give viewers a preview of what lies ahead in the third trimester. This might include more noticeable weight gain and possibly some discomfort as the baby continues to grow. Suggest practical steps for preparing, like setting up the nursery, looking into childbirth education classes, and planning for maternity leave. This helps mothers feel more prepared for the final stretch of pregnancy. Conclusion. 1 minute. Wrap up the video by reinforcing the importance of this trimester for both the baby's development and the mother's experience. Congratulate viewers on reaching the halfway point of their pregnancy journey, and encourage them to enjoy the unique moments of this trimester. Ending on a positive note, remind them that every day brings them closer to meeting their little one, a thought that many find incredibly rewarding and motivating. The second trimester is not only a time of physical change but also one of emotional growth and excitement. This trimester offers a unique window to bond with the baby and enjoy a renewed sense of energy and well-being. Encourage viewers to stay proactive about their health, follow up on their prenatal visits, and cherish the journey as they look forward to the arrival of their baby. Remind them that any questions or concerns should be shared with their healthcare provider, and reassure them that the resources and support available can make a significant difference in their experience. Close the video by highlighting how each milestone reached, whether feeling the first kick or completing a routine checkup, is a beautiful step toward parenthood. Express your well wishes for a healthy, joyful pregnancy as they transition into the third trimester. You might end with a short message like, Enjoy each moment, and remember, you're doing an amazing job. Final tips for video production. To make the video visually engaging, consider incorporating illustrations or animations of the baby's growth during each month of the second trimester. Practical demonstrations for simple prenatal exercises or relaxation techniques. Visual reminders for nutritional tips, such as images of recommended foods and meal ideas. Short testimonials or quotes from other mothers about their second trimester experiences to make the content relatable. A calm, supportive tone throughout will make the content feel reassuring and comforting, reinforcing the message that the second trimester is a time of progress and anticipation. Conclude with resources for further information, such as links or books, to empower mothers to continue learning and preparing for the months ahead. To wrapping up, you can add a brief ending screen that includes helpful resources for viewers who want to learn more. This could list recommended websites on pregnancy health and development, like the Mayo Clinic or the American Pregnancy Association. Names of books that cover pregnancy in detail. Contact information for support groups, parenting classes, or prenatal exercise classes. Social media handles or website links if you have additional content or community support available. 10. Optional. Viewer engagement. 1 minute. Encourage viewers to engage with your content by asking them to like, comment, or subscribe if applicable. You might also invite them to share their own experiences, ask questions, or request specific topics for future videos. A prompt like, "What was the most surprising thing you experienced in your second trimester?" can encourage interaction and build a supportive community. Final production tips. To make the video more polished. Background music. Light, calming music can enhance the mood and keep viewers engaged without distracting from your voiceover or information. Captions and graphics. Include key points as text on the screen to reinforce important information. Captions can also make the content more accessible. Transition effects. Smooth transitions between sections create a cohesive flow, keeping the viewer's attention from one topic to the next. Professional tone and warm delivery. Use a warm, friendly tone in your narration, making the viewer feel reassured and supported throughout the video. A professional yet empathetic approach will enhance your connection with the audience. Further insights on the second trimester experience. To enrich your video and give a more comprehensive look at the second trimester, you could consider diving a bit deeper into a few nuanced aspects. Emotional and psychological changes. As physical changes settle, emotional and psychological shifts also emerge during the second trimester. Many mothers report a lift in mood as early symptoms like nausea fade. Some feel more connected to their baby now that they can feel movement, which deepens the bond. However, emotional ups and downs are common, influenced by hormonal changes and the reality of impending parenthood. Reassuring viewers that a range of emotions is normal, and providing suggestions for coping with stress, such as mindfulness practices or talking to loved ones, can be very helpful. Preparing the home and family. With the second trimester often bringing renewed energy, this can be a great time to start preparing for the baby's arrival. You could cover simple steps for setting up a nursery or planning for space, as well as talking about budgeting for baby essentials. Additionally, if the family has older children, the second trimester is a good time to involve them in preparations, like helping choose items or decorating the nursery. This section can be especially valuable for viewers who are balancing new and previous parenting experiences. Communication with the partner. Pregnancy is a shared journey, and keeping open lines of communication with a partner or support system is vital. Encourage viewers to talk openly about expectations, fears, and hopes, as these conversations can strengthen bonds and ease anxiety. This is also a good time to discuss parenting roles, how both partners can prepare for the baby's arrival, and ways they can support each other. Providing tips for building a solid support system or managing household tasks together can make this segment highly practical and relevant. Preparing the body for childbirth. Although childbirth might still seem far off, the second trimester is a good time to gently prepare the body. This can include light exercises that strengthen core muscles, improve flexibility, and support pelvic health. Simple, low-impact activities like prenatal yoga, stretching, and walking are beneficial for both physical and mental health. If possible, mention consulting with a healthcare provider before starting any exercise regimen, and suggest that viewers explore birthing techniques or classes that might help them feel more prepared. Addressing common second trimester concerns. Address common second trimester concerns that mothers might feel hesitant to ask about, such as changes in libido, skin sensitivity, or dental care, as these are often overlooked yet important. For example, libido. Some women experience changes in libido due to hormonal shifts. Reassuring them that these fluctuations are natural can be comforting. Skin sensitivity. Hormones can affect skin tone and sensitivity, sometimes leading to melasma or increased sun sensitivity. Suggest gentle skin care and sun protection. Dental health. Pregnancy hormones can increase gum sensitivity, making regular dental checkups important. Emphasize oral hygiene and consider recommending that viewers consult their dentist. A brief look ahead. Transitioning to the third trimester. As a final part of the video, give a gentle preview of what to expect in the third trimester. Topics might include preparing for common third trimester symptoms like swelling and fatigue, as well as practical steps such as creating a birthing plan or organizing essentials. This section can help viewers feel more prepared and reassured, with practical guidance on what's to come as they move closer to meeting their baby. Closing encouragement and positive reinforcement. End the video with words of encouragement, acknowledging the hard work that expectant mothers are putting into caring for themselves and their babies. This will make them feel appreciated and uplifted, and reinforce the supportive nature of your video. Let them know that the second trimester is a time to cherish and celebrate, as it brings them one step closer to meeting their baby. The second trimester, typically spanning from weeks 13 to 26, is often considered the most enjoyable phase of pregnancy. This period is characterized by significant physical, emotional, and developmental changes for both the mother and the fetus. Physical changes. As pregnancy progresses into the second trimester, many women experience relief from early symptoms such as morning sickness and fatigue. The body continues to change as the uterus expands, leading to noticeable physical changes like a growing baby bump. This is often when mothers begin to feel the first gentle movements of their baby, typically around 18 to 20 weeks, which can be an exciting and reassuring milestone. Additionally, breast tenderness may persist, but it often begins to subside. The skin may also undergo changes, such as the appearance of stretch marks as the body adjusts to accommodate the growing fetus. While some women might notice changes in their hair and nails, which can become thicker and stronger, others may experience skin conditions like acne or hyperpigmentation. Emotional and psychological adjustments. Emotionally, the second trimester can bring a newfound sense of stability. As the initial worries of early pregnancy fade and the risk of miscarriage decreases, many women report feeling more confident and relaxed. However, it's essential to recognize that mood swings can still occur due to hormonal fluctuations. Encouraging practices such as mindfulness, yoga, or support groups can be beneficial during this time. Prenatal care. Regular prenatal visits during the second trimester typically include important screenings and tests. One significant test is the anatomy scan, usually performed around 20 weeks. This ultrasound assesses fetal development, checks for any abnormalities, and often reveals the baby's sex if the parents wish to know. Blood tests may also be conducted to check for conditions like gestational diabetes or anemia. Nutrition and lifestyle. Proper nutrition is vital during this stage. Expectant mothers should focus on a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Adequate hydration is essential, and it's important to increase calcium and iron intake. Prenatal vitamins are typically recommended to ensure both the mother and the baby receive necessary nutrients. Physical activity can often be resumed or increased during the second trimester, as many women feel more energetic. Light exercises such as walking, swimming, or prenatal yoga can help maintain physical health, reduce stress, and prepare the body for labor. Common concerns. Discussing common concerns during this trimester, such as body image changes, sleeping difficulties, and potential discomforts like back pain or round ligament pain, can also be valuable. Offering solutions or coping strategies, such as investing in maternity support wear, practicing relaxation techniques, or adjusting sleep positions, can help address these issues. Conclusion. As you wrap up the video, emphasize the importance of this exciting phase in the pregnancy journey. The second trimester is not just about the physical changes but also about emotional growth, bonding with the baby, and preparing for the arrival of the new family member. Encourage viewers to enjoy this time, connect with their babies, and share their experiences, reminding them that every pregnancy is unique.